Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
A noun patient of HIV patient admitted to an isolated ward after the abdominal surgery following an accident. The resident doctor who changed the dressing the next day found it to be soaked with blood. Which of the following would be the right choice of discarding the dressings? If any dressing which is soaked with blood, you should put the dressing in an appropriate bag and send it for incineration because it is HIV positive patients. See, HIV soaked dressings, in HIV soaked dressings, contaminated blood bags, or anything, they are category 6, and they have to be either incinerated, or we have to do autoclaving should be done, or we can do microwaving, or chemical treatment is done. Thank you.
thank you and thank you for watching.